This movement is going to focus on a way to massage or lightly release some tension in the front of the thighs or front of the hips, which has been a very big crowd pleaser lately, so I felt the need to do a video on it. So I have some different instruments that I use. First one is going to be just my hands, my thumbs. Next is going to be a pretty standard cane with a hook on the end of it, or this fancy Theracane, right? So first off, we're going to focus on the quads and the hip flexors. So I'm going to lay down on my back with my knees bent. I can have my feet resting on the ground, or if I want to put even less tension in my thighs, I'll put my feet up like this, resting on the edge of a couch or a chair, to make sure that my quad and my hip flexor is very relaxed and there's no stretch on it. Now, I'll start off by just taking my thumb, and I'll find these points right along the top of my thigh and right along the front of my hips. I'll have a patient take their thumbs together, kind of like this, so that they're not putting a lot of torque on the joint, and they'll lightly press in and they'll just say, oh yeah, that's really sensitive. Now, with these points, if it's too uncomfortable, right, you don't have to put pressure right on the source of that pain if it's really sore. It's not going to like that. But if you go just off of it to where it's a little tender but not really uncomfortable, your body's going to be a little bit more okay with that. And if anything, with light pressure, just sustained in that spot for 30 seconds to a minute, you may see that that tenderness gets better. So I tell people, you want to hold the pressure for a fair amount of time. And if it is really sore, you can hold it, or you can do a little pulsing sensation. Now, as you're doing this, you're trying not to make it so uncomfortable that your whole body is tensing, right? So when you put this pressure, you want it to be light, slightly uncomfortable, not anything that's really driving you crazy. And you want to do some very light breathing while you're doing it. So very lightly, I'm trying to breathe into my stomach, relaxing my chest and shoulders. My legs are nice and relaxed. And I'm going to do this light breathing while I hold the sustained pressure for, like I said, 30 seconds to a minute. And I'm going to work my way down the top of my thigh, and I'm going to go until I hit a tender point. So I may have some tenderness up here, that I'll do that sustained pressure, and then I'm going to say, this is fine, this is fine. I might find another spot, and I'll do it again, 30 seconds to a minute. Just working my way down the front of my thigh, only hitting the spots where I feel like it's a little sensitive. Then I'm going to go more to the outside. So maybe I'll take the hand if I'm using my left leg here. And same thing, I can use my thumb. I can put my fingers together to make a little bit more of a dagger type pressure. And same thing, I'll hold sustained pressure as I do light breathing. And I'll hit all these different points like that. Now, what works a little better is an outside object. So it could be anything, edge of a hockey stick, golf club. I'm going to use this cane, but I can do the same thing to spare my hand a little bit, and it allows me maybe to put a little bit more pressure. So just here, arms relaxed, I can lightly push downward. And I can do the same thing that I was doing with my thumbs with this stick. Now what's nice about a cane is this hook on the end, which is going to allow me to hit more of the lateral aspect of it. So with the cane now, and I'm going to run into the wall a little bit, so I'll just take the angle of the cane upward, but typically you would take it right across your hips. And now I can hit more of this angle on the side, where I can catch a little bit more of our good old IT band. And same thing, this is where most people will find the majority of their tender points, anywhere from the side of that hip, working their way down all the way towards the lateral aspect of the knee. And I'm just going to once again hold the sustained pressure, deep breathing, 30 seconds to a minute. Either holding or even doing a light pulsing through these spots. With this cane, the other piece that we use a lot is this Theracane that has multiple pressure point contacts. So here I kind of have this knob where I can lightly press down. I can angle it out to the side. Light sustained pressure. This isn't something you have to torture yourself. I have found that pinpointed pressure like this seems to work a whole lot better than a foam roll, which is very popular. So I'm much quicker to reach for something like this versus the foam roller. It's easier to do. I can hit these specific points without really having to focus on having tension, right? So with myofascial release type stuff, I don't want the muscle to be guarded or really stretched. I want it to be relaxed, because all I'm doing here is changing muscle tone. I'm not breaking up scar tissue. I'm not really digging out at knots. All it is that my muscle, because it's weak, is in this tense, guarded state trying to protect itself. And I'm breaking that tension or that guarded posture by just putting light sustained pressure and getting the muscle to relax. That's all I'm changing is muscle tone. With the majority of your manual therapy, with your different movements that you get out of, or a chiropractor, you say, oh, I feel great. All they did was change muscle tone. Those muscles are now more relaxed, more pliable, they move easier. That's what I'm doing with this. And to change muscle tone, I don't need a lot of pressure. I just need a light, sustained pressure that's a little uncomfortable, but nothing that's really extreme. Okay.